So maybe break down what a typical day looks like for you. Like how many people are you working on? Like what kind of stuff are you doing? The modalities that you're using. I've seen some of your videos where it looks like you're like those cups, dude. I've seen you put them on yourself. I think even in one of the videos, but I've seen you put on some people like in their lats.
Yes.
And dude, that looks intense. So tell us like what a day looks like, what kind of stuff you're doing, what kind of people you're working on. And then I would like to wrap back around to, was it Kevin? Was Kevin Doe? Is that what you said his name was?
Yes.
Was the guy that helped you overcome your injury? So I'd like to wrap. Kyle,
Yeah,
sorry.
No, you're good. You're good.
Yeah. I'd like to wrap back around eventually to like how you overcame that as well.
Yeah, for
you
sure.
know? But tell us what a typical day looks like for you.
So, I see about 4 to 6 people every day.
Okay.
Right. And so each one of those sessions, it's like, once we get in the room, the first thing I ask is what's going on, you know, and, you know, it always varies, but like the reason I stopped using the title of massage therapist in my own private practice.
So what title do you use?
BodyWork specialist.
Okay.
Yeah.
Cool.
So the reason I started saying that more is I actually found that originally through a guy in California who labels himself as a bodywork specialist, who he puts all his work on YouTube. And I just was like, oh, and I like the work that he does. And I started seeing that he does the cupping and the scraping and stuff. And so the sessions are really more like fixing or focusing, really. They're focused sessions, not more so, because when the second you say massage, I just noticed that people instantly think that lights are gonna be off, candles are on, and you're or something, and it's like
rocks.
So yeah, and I'm like, yeah, this isn't my style. I don't really do this. So my style is like, what's going on, right? And so once we get in the room and you tell me, like, when we have numbness in my fingers, right? Or maybe I did sustain an injury like the one I had, or maybe I'm an athlete and I do this, maybe it's my big toe or something, plantar fasciitis, whatever it may be, I just make sure I'm listening. Whatever you say to me, I say it back. And then, okay, I try to understand and try to ask a lot of questions. And then I use basically the scraping. So scraping is, it's an acronym, IASTM, Instrument Assisted Soft Tissue Mobilization. I hold 2 certifications in it, one by Rock Blades, another one by Biologics. And so essentially it's this stainless steel tool, kind of looks like a spoon in some instances, but they can also look like torture devices. As I've been told.
Those are the ones that I prefer.
Some people see them, like they're like laying on my table and they're like, are you gonna like beat me up? Like, what's going on here?
Sean's like, please.
I show up in like a leather gimp suit. I'm like, what's up, man? I unzipped.
It's like, what's going on here? Yeah. But yeah, so like there are these, but the main, function and the scientific reasoning behind them is that you're really just trying to give back range of motion and decrease inflammation that the person may be going through, and while they do look scary, there is a way to use them to be in a way that to relax the muscles, right? Same with the cupping. So when people ask me, what's the difference between like cupping, scraping, putting your elbow in there, what's the difference? And it's like, the thing I tell people is like, all these are just tools, right? You can try dry needling, acupuncture as well. And every body is different. And so every body is going to respond different to all these modalities. You have to try all of them, kind of throw it at the wall and see what sticks. If I have a lot of people who come to me and they're like, I don't really like the cupping, it kind of freaks me out, whatever. I'm like, well, let's try scraping. Okay. And then I have a lot of people are like, no, that's awesome. Like,
so each one of these things are doing the same thing or no?
Roughly. They can have some overlap.
Okay.
Right. But the main function of what they're trying to accomplish is individually different.
Can we talk about that?
Yeah.
Can we talk about the difference? Because it sounds like your 2 main modalities are going to be your hand.
Yes.
When you call that manual therapy. Right? And then the cupping and then the scraping, the IASTM.
Yes, correct.
Okay. So can you tell us the difference between those 3 things?
Absolutely.
And how they work different and who you'd use them for?
We'll start with scraping.
Okay.
So scraping is the act of like, as if I got like a butter knife right here and like the dull edge of it and I was just doing like this, right? It's also known as gua sha, which translates for to scrape in Chinese. Yes. And so the difference is just rationale, right? Gua sha is kind of more used for beauty and cosmetics.
Okay.
So they use it on the face, right? Things like that. In a clinical setting, we're going to say, I stem, scraper, right? And so the difference is when you use it, it's going to create some inflammation. You get what's called petechiae on the skin. It looks like blood vessels are forming. We've seen it as a kid, we fall and play into the playground, you fall, you get a scrape, right? That's why it's called scrape. Right. So there you go. And so you get it, and it causes that inflammation. And when you work out, right, you get sore, right? But then a couple of days later, what happens? It goes away, and you get a little bit stronger over time, right? So we're creating a response along the fascia, right, and along the trigger points, the knots, and we're creating a response to sort of put nutrient supply back in there while also putting a bit of more blood flow, giving more range of motion. Think of it like this. Someone comes to me, and I do what's called a snow angel test. Right. I'm sorry. Is it okay, Sean?
No, you're good. You're good.
Right, I was like, oh, I don't break this in here. This guy's coming here.
You break it, you buy it.
Yeah,
All right.
No problem.
You almost went home with a tripod and a mic, man.
So like a snow angel test, right? So you come up like this, and I kind of see if the ear matches up to the arm here. But some people cannot do that, right? They can't reach overhead. They don't have that range of motion. So maybe I mobilize your arm, have you lay face down, face up. I mobilize, you bring your arm overhead, I scrape along the lats, and I do some motion with it. You know, do that for a little bit, maybe 5 minutes or something like that. Then you might get that range of motion back. And I've seen it happen, you know. And so that's scraping.
Okay.
Cupping is the opposite of compression. So compressing, being smaller, right? Muscles, when you lay, a good example, you lay on your side. Right. So when you lay on like one side for too long, the muscles actually become very noticeably compressed. Maybe not to you when you look in the mirror, because we live in our bodies every single day, wake up or in here, right? We don't really notice. It's so easy for us to not notice those things. But I notice it because I understand, obviously, anatomy. And so a good way that I can tell is when I put somebody's arm behind their back and then I drop the elbow, I'll see their scapula pop out. The little bone, right? And depending on how much it pops out, and then upon further palpation and like kind of feeling it out, you can actually get an idea of like, okay, maybe they do sleep on this side. And then I ask them, hey, do you sleep on this side? You know, and then 9 times out of 10, I'm kind of right. Right? I have been wrong, and there's nothing wrong with that. But I'll ask, you know, do you sleep on this side? Usually I'm right. And then I'm like, okay, so what I can do is put the cups on there. And then the cups, they call it myofascial decompression. So fascia, right, is part of the muscle, right, the encasing of the muscle. It's connective tissue. It's wrapped around our entire bodies, but it reacts to stress. Eustress, de-stress, doesn't matter. It's just stress. And so it can get tight, wound up, things like that, and cause that range of motion, like we talked about earlier with scraping, to get decreased. You know, you've probably never had somebody go in there with a scraper or cup it. So when you take the cup, and you put it like, let's say, along the shoulder blades here, the rhomboids, the upper traps, things like that. And I do this movement called seatbelt. Put the cups in the back, they bring the arm out to the side, and they bring the arm like this. So we're stretching all that fascia. After doing that for about 2 to 5 minutes, you take the cups off. Well, now guess what? Feel better.
So the cups are creating a stretch, and then you're actually stretching it to make a deeper stretch than what would have been possible without the cups. Is that
exactly
the basics?
Yeah, you could have been stretching without the cups, and then, you know, okay, but like adding that decompression to it at the same time adds another element to it that's going to give you that almost instant relief. Yeah. And they do another form of it called loading, myofascial decompression loading. So I have one video actually on my Instagram. I had a bodybuilder. We did some cups on his lats because he had something going on with his lats. And then I had him do some dumbbell rows at the same time with the cups on. You know what I'm saying? And then it's like you take them off and then boom, you know, that pain is gone, you know, and it's like, awesome, cool. That was helpful. That was beneficial for him. You know what I mean? So yeah.
And how do you make that decision just based upon what the person's comfortable with or what the problem is?
Exactly. I listen to obviously the problem, right? You come to me, you know, okay, it's something going on with this muscle up here, man. I just sat at a desk all day, this and that, right? Oh man, it's just like this. And then so it's like, okay, well, let's put a couple cups in there and I might have you just do this kind of movement right here. Just very simple, just this movement, just like this, with the cups on the levator scap, and then do that for a little bit, take the cups off, maybe scrape it a little bit, do this at the same time. You leave feeling like, oh crap, that feels a lot better. But so the decision is made based upon what they tell me in that moment. And obviously I'm very vocal in my sessions to just be like, look, feel uncomfortable, please let me know, right? Is this okay if we do the session like this? Is it okay if, like, you know, we move the head in this direction, that kind of thing? And it's just really, it comes down to the person and, like, in this session, like, what are they coming in for? Like, all that kind of thing.
And then the last bit would be the manual therapy. Right. Which sounds probably more similar to the scraping, but tell us the difference between, I guess, manual therapy and the scraping.
Manual therapy, good old thumb, elbow, fist, right? So many different types, right? You have effleurage, right? Which is just like,
What is this?
This is effleurage right here. So this is just like, as if like a good old,
Like casting a spell on him?
yeah. You could, it kind of looks like it, right? Yeah. But like, you know, if you're like just simple rubbing. Right,
Oh,
just
okay.
simple rubbing.
Gotcha.
Or have you seen a cat like when they wake up in the morning? They do this.
I was not getting simple rubbing from that at all.
Me neither.
He's like getting like a spell.
I was
casting
a
spell on
wizard.
you. Yeah.
Sir Effleurage.
It kind of does look like it. Though.
Yeah.
Like, if you see other people do it, yeah.
Okay. I guess I've never actually, I've never seen someone perform a
Effleurage.
professional massage, to be honest.
No, yeah. You probably like had massages.
Yeah,
but, like,
exactly.
You've seen it. Yeah. But like there's one kneading, right? So like kneading's
okay.
like this, right?
Yeah,
So
yeah.
we had a teacher at Sanjak. She was called it like kneading dough.
Yeah.
Right. Like that.
Yeah.
And then but I utilize a lot of like pin and stretches, right?
A lot of what?
Pin and stretches.
Okay.
So this is a good form of manual therapy, right? So the chest muscle, right, can do this, right? Chest fly, right? But if I put my thumb in here and I come out, give it a nice stretch, pin, stretch.
Okay, I got you.
Dude,
I understand.
I've
now.
done
I'm
that
following.
with we have like the PVC pipes out here, and we'll use those for stretching. And I've like put a lacrosse ball at the end, and like before like a push day, I'll like kind of pin it into my like front lat, and I'll just like kind of go through the motion. And
Oh,
yeah.
it feels really good.
Really loosens it up.
It feels
Absolutely.
really,
But
really good.
having an assistance,
Exactly.
having a third party like do that for you to get your arm in just the right position, I'm sure there's a ton of benefit to that.
Ton of
right?
benefits to it. And then like there's the thing about what's cool about manual therapy is like I could do that with you seated. I could do it with you laying prone. I could do it with you laying face up, face down, side lying, and you're gonna get a different sensation in each one of those positions.